The Hidden Dangers of Ultra-Processed Foods, unveiled by Satori News. As ultra-processed foods continue to dominate dietary patterns around the world, their adverse health implications have become a growing concern among scientists and nutrition experts. A recent study, published in Public Health Nutrition, highlights that low-income South African adults are consuming about 40% of their daily calories from ultra-processed products. This alarming statistic prompts an urgent need to reassess the role these foods play in diets, particularly considering their association with chronic diseases. Ultra-processed foods undergo extensive modifications that are far removed from their original whole food state. These include additions of emulsifiers, artificial flavors, preservatives, and other synthesized ingredients. The significant difference between naturally processed and ultra-processed foods is the inclusion of substances and methods you wouldn't typically use at home, turning them into something that can no longer be considered food in its traditional healthful sense. Kevin Hall, a senior investigator at the National Institutes of Health, NIH, discussed with the New York Times the strong epidemiological evidence linking ultra-processed foods to a spectrum of health issues, from type 2 diabetes to heart disease and depression. Despite this mountain of data, there remains a need for greater understanding of the causative factors. The danger lies in the composition of these foods. They're often rich in fats, sugars, sodium, and carbohydrates. These components can hijack our brain's reward system, leading to hyperpalatability and addictive eating behaviors. The calorie density of such foods often masks their lack of satiety, which means people may end up eating much more than they realize. Consequently, obesity becomes a natural outcome of such unwitting overconsumption. Chris Van Tulleken, a physician and author, has written extensively on the manipulation of food science to maximize consumer addiction. In his view, documented in The Guardian, ultra-processed foods are intentionally crafted to exceed the palatability of whole foods, exploiting our biological drives and contributing to our modern obesity crisis. Beyond obesity, ultra-processed foods also play a role in promoting diseases such as cardiovascular conditions through high levels of unhealthy fats and sodium. The Journal of the American Medical Association, JAMA, has published findings that draw a grim comparison. Ultra-processed foods are designed to last on the shelf, not support human longevity. Furthermore, these foods aren't only linked to physical ailments. Mental health issues can stem from diet too, with high consumption of ultra-processed foods correlating with increased rates of depression and anxiety. Substances found in these foods can detrimentally influence brain function and gut health. Overall, the compounds found in ultra-processed foods contribute to a range of chronic health problems. These include heightened risks of cancer, largely due to additives and chemicals, as well as a potential to cause or exacerbate type 2 diabetes and cardiovascular diseases. With such a stark outlook, consumer awareness and dietary adjustments have never been more critical. Thank you for choosing Satori News.